morning. My name is Jennifer Corsell, and I'm going to be your nurse today. How you doing?
I'm good. How are you?
Good, good. You're Angelina?
Yes, ma'am.
Awesome. And your date of birth?
4203.
4023. Are you 16?
Yes, ma'am.
Oh, are you driving yet?
No, ma'am.
No? Okay. Won't be long, I'm sure. What brings you to the clinic today?
Well, I've been coughing and wheezing, and I think my allergies and asthma are acting up again.
Okay, well, I'm going to ask you a few questions, and after I finish asking you some questions, we'll start with your assessment, and then I'll get to listen to your chest. You okay with that?
Yes, ma'am.
Awesome. Sounds good. Okay, now for some questions. How would you describe your cough?
I don't really know how to describe it very well.
Okay. Is it wet or dry?
I would say it's wet.
Okay, and are you coughing up anything whenever you cough?
Yes, ma'am.
Alrighty, and how about the phlegm? Do you feel any phlegm coming down the back of your throat?
Yes, ma'am.
You do? Okay. And any trouble breathing and shortness of breath?
Yes, only when I'm laying down at nighttime.
Okay, okay. And do you have any tightness in your chest?
Yes, sometimes I do.
You do? Can you show me where that hurts?
Like right here.
Okay. And when it hurts, is it constant pain or does it come and go?
It comes and goes.
Okay. And are you wheezing whenever you have
Yes, I hear a wheezing sound.
that? Okay.
Yes,
That
ma'am.
sounds good. Thank you. Okay. Do you smoke?
No, ma'am.
No. Good. That's great. You should never start smoking. That's really important to know because that can lead to a lot of health problems like cancer and difficulty breathing, especially with your history of asthma. You really don't want to start that habit, right?
Yes, ma'am.
Good job. Does anybody in the house smoke?
No, ma'am.
No. Great. That's awesome. Okay, now we're going to do the assessment part. Let me get my hands washed up real quick, okay?
Yes, ma'am. That sounds great.
All right. So you enjoy your summer?
Yes, ma'am.
Great. I'm so sorry you're not feeling well.
It's okay. We'll get it straightened out.
Yep. You'll be good as new.
Yes, ma'am.
Get that all straightened out. Okay. So what I'm going to do now is use a pulse oximeter.
Okay.
A pulse oximeter measures the amount of oxygen you have in your blood, okay?
Yes, ma'am.
I'm assuming you've used one of these before,
Yes,
right? So you know it doesn't hurt.
Yes, ma'am.
Yeah, okay. So, I'm going to put this on here. You see your fingers. Checking for capillary refill. It's got good, quick refill. Okay. Alrighty. It's coming up. Good deal. Good deal. Alright, your pulse ox is 98%. That's really good.
Awesome.
The normal pulse ox is 95 to 100. Okay?
Mhm.
So if it was lower than 95, then we would be worried about not getting enough oxygen in your blood
Okay.
and being hypoxic. And that's real important whenever you're
Yes.
having difficulty breathing. So we want to make sure that you're getting enough oxygen. Okay? So I'm going to check your respirations and I just want you to relax and breathe normally, okay? Okay. Just relax. Just relax. Okay, so your respirations are normal. You're breathing at 16 breaths per minute, and it would be, if you were breathing greater than 20, it would be tachypnic, but you're breathing fine. Okay, so we would worry about you having some shortness of breath, but that looks to be normal.
Yes, ma'am.
Okay, and have you ever had any trouble breathing where you use all your muscles to breathe?
No, ma'am. That's never really happened before.
Okay, good deal. Okay, so this part of the assessment, I'm going to need you to turn. I'm going to actually touch you, okay? So if you would turn this way for me. all the way, yeah, there we go. Okay, scoot a little bit more, yeah. All right, take a deep breath. Okay, good deal, awesome. All right, that's good. And I'm gonna touch you up here, okay? And I need you to say 99 for me.
Okay, 99, 99, 99,
Good.
99,
Uh-huh, one more time.
99.
All right, good deal. Now this portion, I'm gonna tap on you, okay?
Yes, ma'am.
Okay, almost done.
Okay.
Alrighty, good deal. Okay, and now I'm gonna listen to your chest. Okay. While I have you turned around, I'm just gonna go ahead and clean my stethoscope real quick here.
Okay.
Okay. Good deal. Just take a listen. Take a deep breath. Again. Let's try to get in there. Again. Okay. Go under your shirt, okay?
Okay.
Deep breath. One more time. All right, good deal. Good deal. Okay, now we'll do the front portion, same as the back, but now we'll be in the front, okay? All right, so I'm gonna put my hands on you again here. Take a deep breath. Okay, good, that's equal, okay? Now remember 99? Let's do 99.
99, 99, 99, 99, 99.
Okay, good deal. And now we'll do the tapping, right? So, all right, we'll go under here. Let's see if I can get there. Okay, and right here. Alrighty, and now I'll take a listen to you. Okay, and just try to breathe slowly with deep breaths because I don't want you to get out of breath like you did the first time, okay? Alright, ready? Deep breath. Okay. And again. Okay, let's get in here. Okay, go underneath your shirt here, deep breath. Again. Okay, that wasn't too bad.
So, what were you just listening for?
I was listening for abnormal breath sounds, and you have several different types of breath sounds. You have bronchial sounds, you have vesicular sounds, and you have bronchovesicular sounds. So, and I do have to listen to one more thing on the sides, okay? So I'll listen to you on the side. You didn't realize you had so many breath sounds, huh?
Yeah.
Deep breath. Okay, and one more time. Okay, good deal. Well, I did hear if you want mild wheezes, okay? And that's that high-pitched musical sound that you hear, right?
Yes, ma'am.
And so we need to get you some medicine on board for that. You've already taken albuterol inhaler. Do you have your inhaler with you?
Yes, I do.
Good. Good deal. So I want to see how you use your inhaler, okay? But I do have a little video that I want to show you that will help you know how to do it properly, okay? And then you can demonstrate to me how you do this, okay? So let's see. Okay. Let's get this little video going. I think you're able to hear it loudly. Okay. Technical issues, right? Isn't it always the case? Here we go.
Remove the cap from the inhaler. Shake the inhaler well for 5 seconds.
Now this is really important for a whole 5 seconds, okay?
Hold the inhaler firmly by placing your index finger on top of the canister and thumb on the bottom of the mouthpiece.
See it good?
Yes, ma'am.
Sit up straight or stand up. Tilt your head back slightly.
You want to aim it towards your throat.
Exhale away from the inhaler.
Nice long breath.
Put the inhaler in your mouth. Press the inhaler and start breathing in at the same time. Take a slow and deep breath.
Okay. It's a little exaggerated, but you get the gist, right? You do.
Hold your breath for 10 seconds.
Okay.
Exhale slowly through your mouth or nose.
Just remember to hold your breath for 10 seconds so you get the medicine in. Okay. Or as long as you can.
Repeat 2 to 8 steps after 30 seconds if another dose is required. If you are using a corticosteroid medication, rinse your mouth after all doses are complete.
All right. That was a good little tutorial.
Yes, ma'am.
Okay. Now, could you show me how you do your own inhaler?
Yeah, sure.
Good, good. How long do we have to shake it for?
5 seconds.
Very good. Okay. Remember, hold it in for 10 seconds and then breathe out, correct? Very good, very good. Okay, good deal. I know you said that you didn't smoke, but you need to remember that being around cigarette smoke, juuling, or vaping, that can also trigger your asthma, so you want to stay away from that kind of stuff. I know there's a real big problem right now with teenagers that are vaping and juuling, you know?
Yes, ma'am. I know a couple people who do it.
Okay, so really just try to stay away from that, okay?
Yes,
So we don't want to harm you and have you had, a relapse with your asthma once we get it under control, right?
Yes, ma'am.
Good deal.